Here we go. Preparatory and initial response. This is the first module in a series of 7. Here's the scenario. There's been an incident and you have to prepare for the arrival of casualties. But at this stage, you don't have any more details than that. You don't know what sort of incident it is, you don't know how many casualties may be arriving, and you don't know what sort of injuries they may have. So you're preparing for the unknown, which can seem like a pretty daunting prospect. But don't panic, because there are some general rules you can follow that will help. Let's begin with you.
One of the first considerations is protective equipment. Think about what you're going to be doing and where you'll be assigned. The equipment you'll need outside, on deck and within the survivor's accommodation obviously differ. Think about what's appropriate for the tasks you'll undertake. All crew should be appropriately dressed for their designated or expected tasks in accordance with recognised safety guidelines.
No, listen this time. Double cheeseburger, large fries, Diet Cola, because I'm watching my weight. Where was I? Personal protective equipment, otherwise known as PPE. It is quite literally a lifesaver, but it's not going to help you very much if you're not using it properly or if it's in poor condition. How many times, for example, have you seen that walking around the deck? Having loose zips, loose buckles is not big or clever, it makes you a big girl's blouse. If you are unsure of any item of PPE, for God's sake, ask. As part of your routine every single day, familiarise yourself with all the PPE that's available to you. Make sure you know where to find it and how to use it. Check, for example, that everything fits. Because if there's anything you need that you don't have, it's your responsibility to ask for it.
Different roles on board will require differing levels of protective gear. Deck duties can be potentially hazardous, so you must be well protected. Insulation is vital. Wear warm layers of clothing under your coveralls. These layers will trap and retain heat. Over this you'll need a water-resistant deck suit, life jacket, hard hat and chin strap, appropriate footwear and a safety harness. Arrangements for decontamination of survivors vary according to the ship's layout. Accordingly, the level of PPE required should be considered. However, as a minimum, those of you designated to decontamination duties should wear a hard hat, protective footwear, an apron over water-resistant clothing, and rubber gauntlets worn over surgical gloves. Areas within the survivors' accommodation offer a greater degree of protection from the elements, so designated response crew should ideally wear coveralls. However, as a minimum, aprons and surgical gloves must be worn. Supplies must be kept well stocked, so protective clothing can be changed between casualties if required. Remember, PPE is supplied not only to protect you from the elements, but also, and perhaps more importantly, from the risk of infection or contamination transmitted through the exchange of blood and fluids. The risk of transferring any infection or contaminant to others in your care can be minimised by adopting good practice. Start with the basics. Wash your hands thoroughly before and after dealing with each casualty. Double gloving will reduce the risk of cross-infection and allow the wearer to remove soiled items and replace them when appropriate. Wear protective gloves and aprons at all times and dispose of soiled items correctly. Avoid touching wounds and try not to breathe, cough or sneeze over a wound whilst dealing with injuries. Use a pocket mask when resuscitating and take extreme care with needles and sharps. Mop up and dispose of spills safely. Dispose of all waste correctly. Remember, everything has a place. Use marked bags and containers.
Sometimes, if you want to make yourself heard, you have to shout. There's a serious point to this, because during an incident, effective communication is absolutely vital. Messages have to be relayed both throughout the vessel and to external agencies so that the appropriate people and services can be deployed.
Internal communications should not interfere with any external transmissions. External communications provide a means of contact between the numerous search and rescue resources and should only be operated by suitably qualified personnel. Transmissions made on open marine and aeronautical channels are not secure and can be listened to by others not directly involved with the incident.
Scott Guardian deck, Scott Guardian deck, Scott Guardian bridge, radio check.
A test of the communication network should be conducted involving all designated communicators.
Tigris Bridge, Tango 1, radio check.
Tango 1, Tigris Bridge, you're loud and clear.
Both the internal and external communications check should establish the clarity and strength of transmissions between the operational areas.
We've stressed the importance of good communication, of infection control, and we've looked at how you can best prepare yourself. The next question is, how do you make ready the key areas you'll be using to receive and handle survivors?
The ship survivors' accommodation should be maintained so facilities are available at a moment's notice. They should provide a protected, safe and comfortable environment for any survivors received on board. Routes and alleyways should be kept clear, doors secured and equipment fastened to decks and bulkheads. Survivors should be restricted to designated areas unless specified. Simple things such as heat, light, warmth and nourishment are all vital to how well survivors cope with the emergency. Make sure everyone is allocated a space, advised of the layout and location of their facilities. You may have to use crew accommodation for survivors, but certain areas should not be used. These include bridge, radio room, galley and storage areas, main passageways, crew sanitation, master's berth, 2 of the crew's cabins. With limited resources available on board, the organisation of assistance and transportation is another crucial element of the rescue. Stretchers should be kept ready for use. Strops must be secured to stop them trailing and getting tangled. Blankets should be placed inside each stretcher, ready for receiving casualties, and the KED device and spinal board should be ready for deployment if appropriate. Place stretchers to allow for the likely requirements. Remember, feet first down stairwells, head first up stairwells.
We take the casualty from over there. Okay, when he comes on board, straight up this ladder.
Routes to destination should be pre-planned and well rehearsed.
Right. Are you happy with what we've done so far? Good.
Basket stretchers are designed to slide and when suitably rigged can be lowered down or heaved up narrow stairwells. Stretcher lifts should be a coordinated affair, controlled by the rescuer at the head of the stretcher and lifted in a manner which minimises the risk of back injury to the bearer. Keep the casualty informed of your intentions at all times. It's appreciated that given the average crew complement on board your vessel, resources will be at a premium. Effective and efficient organisation and deployment of ship's crew will offer a better chance of success, and all crew members must be willing and able to participate in the rescue.
His name's Mike, he's a rigger, and it looks as if he's got abdominal problems, that's all we know at the moment. But he is conscious, you can't talk to him.
Refer to the ship's station bill or muster list when you first join your vessel and familiarise yourself with the role expected of you. If you are in any doubt, ask a senior member of the crew to explain it to you.
If you spend half your life on ships, then maybe this ghastly rolling motion doesn't cause you any problems anymore. But bear in mind that survivors who come on board might not have their sea legs. In addition to being traumatized and possibly even injured following an incident, they may also be prone to seasickness. So show some patience and bear with them. I think I actually have to puke.
There's every likelihood that casualties received on board your vessel may be contaminated in some way. The most obvious contaminant will be oil-based, and the main purpose of the procedure will be to clear substances from the eyes, nose, mouth, ears and hands. Aim to remove as much of the contaminant as you can before allowing the survivor to proceed to the accommodation areas. which in turn will maintain the cleanliness of such areas. Contamination of the skin will result in differing degrees of irritation, and skin can become red and inflamed. The eyes, mouth and nose should be dealt with as soon as is practically possible. Being delicate structures, the eyes may react to oil contamination by becoming red and itchy. Oil-based contamination of the eyes is best dealt with at a later stage using liquid paraffin drops.
Fit survivors can largely perform the procedure themselves with some assistance from you. Encourage them to clear their nose and wipe nostrils with water-soaked swabs and rags, using a fresh rag each time. Draw contaminant away from each area using a soaked rag in downward strokes. The liberal use of detergents will loosen the oil-based contaminant around the other areas of the body and help ease the process.
Whilst fit survivors may be able to look after themselves to a certain extent, injured parties will need your care and attention throughout. The nature of the injury will largely dictate the degree of support required. A swift and methodical approach to essential decontamination should be adopted to avoid bottlenecks developing. Extensive contamination may disguise or hide serious injuries, and you should be alert for such a possibility.
Breathe. Can't breathe.
If in doubt, ask the casualty how they feel.
Domination is eyes. Stand up slowly.
Oil inhalation will result in severe breathing difficulties, which will undoubtedly take precedence of treatment, whilst ingestion, although not poisonous to the casualty, may cause nausea with vomiting.
Take your time.
Removing irritants from the eyes is best achieved in a more controlled environment than that presented by the decontamination zone.
That's better. That's better.
Okay.
That's better.
Have plenty of clean rags available and a suitable container to receive waste. Provided the desired temperature can be maintained throughout, switch off showers when not in use.
Although it's preferable to remove and dispose of contaminated articles of clothing at an early stage in the proceedings, it is inevitable that some oil contaminants will be brought into the survivor's accommodation.
The risks presented by such an occurrence should be obvious to everyone. Such spillages should be mopped up on a regular basis to avoid the risk of further injuries to those rescued or performing a rescue role.
All survivors are received in the reception area. It's here that documentation is supplied and an assessment is made of their condition. From here they'll be taken to the treatment area, the recovery area or the dedicated seating area.
The initial decision on what actions are appropriate for each casualty is based on a rapid assessment of the casualty's condition. However, the process is a fluid one, and priorities will change as the incident progresses. One of the prime aims is also to make best use of what are undoubtedly limited resources. An extensive array and supply of medical facilities is unlikely in itself to save lives. Effective management of personnel is essential to complement the process, and it's very important to retain an overall perspective of the situation, so as to further organise and coordinate personnel as the situation demands. Invariably, the Advanced Medical Aider, or AMA, will ensure these aspects are catered for. This will involve a process of delegation to the other crew members, as the AMA cannot be expected to be the saviour of all. All crew members must be prepared to assist in any tasks related to the rescue and care of survivors, and follow the instructions from the AMA if necessary. The AMA's role will be made much easier with the support, cooperation and appreciation of his colleagues.
One of the vessel's most important functions is the accounting of everyone who's brought on board. External agencies need to know the numbers and the status of survivors, and that information is also vital for the coordination of search and rescue operations.
As well as making initial assessments, you'll be issuing survivor packs to survivors. Survival packs, although basic in content, are nonetheless an important part of the care function when dealing with survivors. A change of clothing combined with a thick pair of socks and a warm blanket can make a surprising difference to the mood and perceived level of comfort amongst a traumatised group. Seasickness is a debilitating and unpleasant condition caused by confusion of the nervous system, which is affected by the motion of the vessel.
How's this guy? How are you? How are you feeling? Is your hand okay?
Tablets are issued as a preventative measure, whilst those who are already too sick to tolerate medication orally might be administered an intramuscular dose of hydrazine hydrobromide to treat and control the problem should its severity warrant such action. As with all medications, its administration should be recorded. As we will see later, the International Cruciform card has a numerical record incorporated which can be used to track and identify survivors if preferred. Recording methods vary from ship to ship, but some means of collating and controlling the information must be maintained for the system to be effective. The ship is supplied with ID bracelets, and these should already be annotated in a numerical format for issue in the event of an emergency. Some vessels may prefer to simply write consecutive numbers on the casualty's person using a waterproof marker pen. The early stages of an emergency involving multiple survivors can be a fraught and hectic period, and as should be expected, the survivors' care and prioritisation of treatment will take precedence over establishing factors such as the employer details or date of birth. Some of the detail might be obtained by reference to ID badges, monogram coveralls, immersion suit serial numbers, etc.
Even the most experienced crew is going to find itself challenged by a situation involving multiple casualties. If you do find yourself stretched, bear in mind that there may be survivors who have skills you can utilise. But if you're going to accept the help of a survivor, make sure you restrict them to below decks and make sure they're fit and able to do the job. The sorting of multiple casualties into groups for treatment or evacuation is known as triage. Effective use and application of the triage principle will make it far easier to cope. As we mentioned earlier, the International Cruciform card here is one of the most commonly used methods.
The colour-coded card system can be used to sieve and/or sort casualties, identify records, personal possessions, and even separated body parts. It will provide a verifiable link between casualty and possessions, which may have been bagged up for forensic examination after the event. The incorporated numbering system will provide an indication of how many survivors are received on board, and as the card remains with the survivor throughout, it provides a means of recording the treatment and history associated with each. The card is divided into several modules, and any one or any combination can be used for each casualty, depending on the skills of the rescuer or circumstances prevailing at the time. Where manageable numbers of casualties are presented, use the cards to systematically identify, prioritise and process those injured. During major incidents where resources are at a premium, use the triage sieve to rapidly prioritise injured casualties in the initial stages. These initial priorities will be refined when resources allow for a more detailed examination of each casualty to take place. Use the casualty estimate on the reverse of the triage sieve to keep track of how many casualties have been processed and move those categorised to the appropriate areas on board the vessel for further treatment and examination. During the initial stages of the incident, do not waste time writing down anything on the card, but apply the wristband to link casualty and card and take a numbered tag for the reception area records. Categorisation of priority is based on achieving maximum benefit and identifies those who will survive given available treatment as opposed to those who are unlikely to survive the incident despite all efforts. Examples of the priority levels are Group 1, Red. Immediate casualties are those who are likely to die soon unless they receive immediate life-saving treatment. but who are likely to survive if appropriate treatment is given. Group 2, yellow. Urgent casualties are those whose condition is such that they could die from their condition, but not immediately. Group 3, green. Delayed casualties would be categorised as those whose injuries are such that they are unlikely to die from them, whether they receive treatment or not. Unfortunately, there is always a likelihood that some of the casualties of an incident may not be able to withstand the severity of their injuries. While some may be recovered to the vessel in a condition which dictates that they are obviously dead, others may pass away whilst in your care, despite all your attempts to support life. Protocols advise that in such circumstances, the cruciform card should be adjusted to show a green face with the corners folded to display white flashes, which indicates that the casualty concerned is a non-survivor. Confirmation of death will be made by legally qualified personnel, who will subsequently change the card to show white and then complete the relevant details on that page. Mistakes have been made when trying to determine whether death has occurred in respect of casualties who have been rescued from cold water environments. The signs and symptoms displayed by a profoundly hypothermic casualty can lead the observer to believe that they are dead. Lack of movement, negligible signs of circulation or respiration are all factors which could influence the rescuer to classify the casualty as a non-survivor during the sometimes hectic initial stages of a major incident. As a general rule, however, cold immersion casualties should not be regarded as non-survivors until they have been rewarmed to normal temperature and still display no signs of life. Body bags are provided for non-survivor use, and those designated should be placed within them at a time when resources become available to assist in the process. Any personal belongings should be placed in the bag with the occupant. As a matter of protocol, the zip should only be pulled up to a point where the person's face is still visible. The bag is never sealed until the doctor has officially declared death. The triage label and all associated information, such as where they were found, the nature of the incident which led to the condition, etc., should be secured to the bag.
The task of coping with non-survivors is something we hope you'll never have to deal with. But if it does happen, remember this much. The non-survivor is still somebody's loved one. They're to be treated with dignity and respect.
As any incident progresses, more rescuers should arrive, and as the situation on board your vessel starts to become more organised, further information can be gathered about each casualty. The Casualty Assessment module provides a convenient checklist and record of injuries found and treatment given subsequent to both primary and secondary survey. The Casualty Details module can be filled in as soon as convenient. Basic medical aiders or any available person can be used to compile this information. All persons involved with the casualty may at a subsequent stage be called forward to give evidence, and it's vital that everyone is identified. This module gives a convenient place for that information to be written down. The unique number allocated will also assist rescuers in identifying specific casualties after the incident or to clarify which casualty has gone to which destination. The Trauma Score module may be used for the traumatically injured casualty. Do not attempt to use it unless trained. This is the only way to ensure that the information recorded is accurate. Use the additional observations, treatment given, and comments module provided to document any additional information not catered for elsewhere. For example, known or suspected medical conditions, personal effects, suspected contaminant, or next of kin, etc.
Triage is a fluid process, and that means priorities can change. So it's important that when casualties are being treated, or even when they're awaiting treatment, you keep an eye open for an improvement or a deterioration in someone's condition.
This animation demonstrates how the triage process might be encountered on board a typical emergency response and rescue vessel. Survivors arriving on board are decontaminated where necessary and taken to the reception area. At that point, a crew member quickly evaluates their priority in accordance with the triage sieve, and they are allocated to appropriate areas on board the vessel. Those requiring immediate, red treatment are taken to the treatment area, and once their condition is stabilised, they are recategorised as green, delayed, and are transferred to the recovery area for continued observation. Once all red, immediate casualties have been dealt with, those categorised as yellow, urgent, are attended to as the next order of priority. The seated area is beginning to fill up, and those green, delayed casualties with initially assessed minor injuries are allocated to the front rows and are attended to by a crew member. Those determined as being fit survivors are separated from those injured and are allocated seats to the back of the area. We return to the scene at a later stage, and the bulk of the survivors are on board. Two of the survivors in the seated area, who were initially prioritised as delayed green, have developed breathing problems. Their priorities are recategorised as urgent yellow, and both are taken to the treatment area for re-evaluation and, if necessary, treatment. Meanwhile, a casualty under observation in the recovery area is showing signs of deterioration, to the extent that his priority has risen from green, delayed, to yellow, urgent, and arrangements are being made for his evacuation to shore. Remaining casualties are stabilising, and fit survivors are assisting the crew to observe casualties and gather more information. In this animation, we've seen that priorities change, resources must be adaptable, and the route through which survivors are attended and treated can vary.
Around, put you on the old chair tightly. Okay.
It will take an efficient and practiced crew to cope with such demands. The process of using the triage system for evacuation purposes is addressed in a later module.
This has been just the first training module, but there's been a lot of detail, and we appreciate it's a lot to take in. The important message to remember is preparation. Get the basics right, and everything else should fall into place.